1/3 of patients, usually ones who the clicking and popping has been around for the least amount of time, 1/3 of patients will have complete resolution when we start treating them through immobilization, manipulation, just adjusting the joint capsule and working on the muscles around the jaw. That's usually because we've gotten our disc anteriorly displaced and we have so much compression on the condyle from muscular overactivity and joint capsule tension that we can't create enough space for the disc to snap back. So the ligament's not stretched out. The jaw is literally creating a wedge where the disc can't pop back. So I adjust them, boom, pull the condyle down, the disc snaps back. They have complete resolution of clicking and popping. It's usually a slam dunk, right? Sometimes it takes 2 or 3 adjustments. Sometimes the very first adjustment, clicking and popping goes away permanently. But that's only about 1/3 of patients.